Hi, I'm Marianne Quintana, and today is February the 10th, 2019, and I'm here to show you the axial and appendicular skeleton. For the anterior skull, we have our nasal, sphenoid, lacrimal, ethmoid, zygomatic, maxilla, mandible, frontal, and our vomer. For the posterior skull, mandible, occipital, parietal, and temporal. For the lateral skull, we have our ethmoid, frontal, lacrimal, mandible, maxilla, nasal, occipital, parietal, temporal, and our zygomatic. For the inferior skull, we have our ethmoid, frontal, occipital, parietal, sphenoid, and our temporal. And our vertebral column, we have our atlas or C1, we have our axis or C2, and we have our cervical vertebrae. So that's we have 7 cervical vertebrae. And then our thoracic vertebrae, we have 12. And then our lumbar vertebrae, we have 7 lumbars. And then our sacrum and coccyx. And then for our thoracic cage, we have the body of sternum, manubrium. We have the true ribs, or the first 7 ribs. So this is our true ribs. Our false ribs, the last 3 ribs, because it's not connected to the sternum. And then our floating ribs, the 2 ribs in the back that are not connected to anything, to the front. Our pectoral girdle and upper limbs, we have our clavicle, our collarbone, humerus, radius, ulna, and scapula, or our shoulder blade. For the hand and wrist, we have our trapezium, trapezoid, capitate, hamate, pisiform, scaphoid, lunate, triquetrum, our metatarsals, and our phalanges. For our pelvic girdle and lower limbs, we have our ilium, ischium, pubic bone, femur, patella, tibia, and fibula. And then for our ankle and foot, we have our medial cuneiform, intermediate cuneiform, lateral cuneiform, cuboid, navicular, talus, metatarsals, phalanges, and our calcaneus.